So at every step of the way, as we look at the public health infrastructure, there are core capabilities that have to be in place for us to respond. I'll point to the emergency care system as another place. If every day your emergency departments are filled to the gills with people boarding in the hallways, how on earth are you going to clear out that? And you can't clear it out. How are you going to clear it out if there's a mass casualty event in your community? You're not, and you're not going to be prepared, and you're not going to be ready. So figuring out what you're going to do in your emergency departments to deal with boarding and crowding is central to what it's going to take our health system to be prepared. If, in fact, as is the case now, the emergency medical system only gets paid when they drive the ambulance from wherever the 911 call was to the hospital and have no discretion and make no judgment about whether that person needs to be in an emergency department, how on earth can you expect people to make those judgments in a huge disaster when the emergency department resources are scarce and you're going to have to take people somewhere else? You've got to practice this stuff day to day. And if you can't do it day to day, you're not going to be able to do it on game day. And finally, to say again, and you all know this, that this is a really complex adaptive system. And at the end of the day, we're only as strong as and as prepared as our weakest link. And so we have to focus not only at the federal level, but at the local level and the community level in terms of strengthening our health and public health infrastructure. So where does public health systems and services research fit into all of this? And in sort of thinking about this, I've just been thinking about what really distinguishes it from all of the other kinds of research that we do in public health or that we do as academics or wherever it is that we choose to work. You know, and first, one of the things I would say is it deals with a different kind of question. The types of questions that one tries to ask and answer are really different. It deals largely with complex adaptive systems rather than with stovepipes, rather than a individual link in that chain. It's got to deal with the whole chain. That just makes it really hard, and it makes the measurement aspects of things very challenging. That the constructs that we are now dealing with as we recognize the complexity of these systems that we're dealing with are very difficult often to describe and very challenging to measure. And it's one of the things that for me makes this field really fun, because I don't like to do really easy stuff. Somebody else could do that. But it is very challenging, and it's one of the issues that we've got to deal with as a field in helping people understand what it is that we do and helping at the end of the day for us to have findings that people will pay attention to. Now, I would say here the measures don't have to be perfect, and I think there's a tendency for us to sort of iterate on perfection before we sort of, you know, take the sheet off and show it to the world. If I think about, you know, models in the healthcare system, you know, quality measurement in the healthcare system has been around and been growing and developing for years and years and years. It was in 1979 that New York State first unveiled or first reported on mortality from cardiac artery bypass surgery. They were really crummy measures, and they were unadjusted for anything. And people railed against them, but they used them. And in their railing against them, they made them better while they used them. And I think for many of these constructs that we are trying to measure in this field, we're going to find the same thing. I think we can learn a lot of the lessons that we've learned from quality measurement in other areas. They're not going to get better until people are used and until people use them and until there are consequences for their use. And finally, I would say that the kind of work that gets done in this field more often than in the sort of academic pursuits that I'm more used to, more often aims to promote some kind of action rather than to elucidate either how a link in the chain works, how a molecule works, how a part of a cell works. And again, that's a really big distinction, but it's one of those things that makes it very hard for people to understand. And it's not really reductionist. So in most academic settings, you know, you get rewarded for becoming a super specialist in one area or another, and that you become the person, if you're really successful, that, quote, owns that area. You know more about that than anybody else. But it's a teeny little piece of what is a really complex system. And what this field is trying to take on is the complex system. And that, I think, poses challenges, I think, for all of you. In addition to the types of questions, I think that working in this field requires not a single, but multiple research paradigms and multiple disciplines. And one of the challenges here is that each one of these has its own culture and beliefs. So as I said, my formal training was more in health services research and learning to use large data sets, and I started off working in the areas of access and quality, and still do. Along the way, I met epidemiologists, and I started to learn epidemiology. And health services people and epidemiologists have really different ways of looking at the world. Sometimes they deal with the same problems, but they call them really different things. And it took me a lot of years to understand that epidemiologists deal with selection bias too, but they just call it something different, for example. So we've got a different language, a different vocabulary, a different worldview, a different approach. Same thing with economics, same thing with sociology, same thing with evaluation research. All of those things have to come together for this field to be successful. And we can beg and borrow and piece together things from each of these fields and disciplines, particularly on the analytic methods side. But I don't think any one of them alone is going to do the trick. And I think we're still learning as a field how to do that. In this field, as a result, I think that the methods and data sources that we use are still very much in development. And as I said, I don't think they fit this classic academic mold. So Deborah Perez and I were talking last night about the very first conversations that we had about data sets. And certainly when my first PHSSR meeting, there were no data sets. And we were sort of thinking, well, what data are out there and how do you link them together? And the field has come a long way since then. And I don't know where Glenn is, if he's here. But, you know, he's really been a pioneer in sort of linking a lot of these data sets and things together. But then the other thing you have to do is link them to reality and link them to the way the world really works. And a lot of times reductionist data sets don't link very well and don't represent very well the way the world works. So that's another challenge that this field has to face, that the methods and data sources are still in development. I think that's what makes it really important. But at the end of the day, because it's not reductionist, because it's not dealing with a little stovepipe somewhere, I think it's going to be much better situated to make a difference, to promote action. In fact, just because of that challenge, because it deals with the world as it is, rather than as we would like it to be in a carefully controlled experiment. So then I think a little bit about going forward. And I will say that I anticipated that I would be speaking mostly to junior investigators here, not senior ones. And so I was sort of thinking about, well, what would I want to say to all of you starting out in this field? And the first thing I guess I would say, and I think that many of you in this room I know have lived that, ask and try to answer questions that really matter. Just because a data set is there doesn't mean it needs to be analyzed. Just because you can link pieces of data together and do some regressions doesn't mean you should. It sounds like this is resonating with some of you. But really focus on things that matter and at the end of the day are going to make a difference, and at the end of the day are things that people can take action as a result of. Get out of those academic and disciplinary stovepipes. For me, I'm sort of wired that if you try to put me in a box, the first thing I try to do is get out, no matter what it is. So for me, that's relatively easy. For others, it's a lot harder, and it can be pretty uncomfortable, but I would urge you to do that. Say, work on breaking new ground. And once you've got something started, then lots of others can pick it up and try to perfect it, particularly in the methods areas, particularly in the measures areas. But what I'm looking to this field to do right now is break new ground, introduce really new thinking and new approaches, because that's really what this whole field needs. And the last thing I would say, and I'm looking at a lot of you probably already have tenure, so you think I'm crazy, but don't worry about getting tenure. I think it can lead you down some really strange paths. It can make you link those data sets and do those analyses and write those papers that you can publish but that really don't mean anything, just so that at the end of the day you have the required number of publications on your CV to get promoted. But at the end of the day, you haven't made a difference. And at the end of the day, particularly as we're looking at what's happening to funding in all of our academic institutions, tenure doesn't really mean very much. It means that they can cut your salary to $10,000 or $15,000 and pay you a base salary, but you have a secure job at that. I'm not sure that's really what we're all in this field to do. So I would say instead, worry about making a difference. And that if you make a difference, I think the rest of it's going to follow. For those of you who are in leadership in academic institutions here, one of the things that you can do is go back and really revisit your promotion and tenure systems and try to think about how it recognizes and rewards and celebrates people who really make a difference, people whose work really creates change. And it's not, rather than just measuring the number of publications, for example. And then I think finally within that, I think we all know that publishing a paper is not enough. In this field that we are in, it is really complicated to explain and to understand. But at the end of the day, if you want to hook it to the real world, you've got to use your non-research skills to make a difference, to take those findings out to the real world, to help people experiment, to help people implement, whether it's folks in health departments, whether it's community organizations, whether it's businesses, whether it's schools, whatever it is. They are, all those skills and all those links are part of PHSSR at the end of the day. They're part of these systems, but they're the part that's not the R. And I don't think that we can forget for a moment the PHSS part of this field. So that's really all I wanted to say this morning. I hope I've given you a little food for thought, and am happy to take some questions. Thanks.